welcome back to the Oral Health Podcast. Now, today, you might not know, but it is Toothache Awareness Day. We're going to just have a bit of a discussion on, some of the more worrying stats that are coming out about toothache and its impact, as well as, the signs, what the possible causes are, and what you can do to try and ease the discomfort you might feel. Karen, obviously, back again. How are you doing, Karen?
I'm good, thank you. And what a national day to have. I think people would rather not have a National Toothache Day if they've got to have toothache. But yes, it's important to realise why you might be suffering that pain
Yeah.
and what to do about it. And when things are, perhaps urgent or and you need to see somebody quickly and uh, try and take away one worry anyway.
Yeah, absolutely. Well, just on just the few statistics we've got from the research we've done over the years into toothache, there is an astonishing 4.8 million work days that have been lost due to poor oral health. And according to the Chartered Institute of Personnel and Development, that equals about £300 million lost to the economy every single year.
Wow.
1 in 4 5-year-old children have tooth decay, affecting an average of 3 to 4 teeth. As few as 7% of adults have received occupational health information from their employers about the importance of good oral health and oral hygiene. 7,926 children under 5 have had one or more teeth extracted in hospital under general anaesthetic, and 1 in 7 have had to take time off from work due to poor oral health. Now, we obviously look at those and go, that's the cynical part might go, that
Staggering.
sounds about right, because we know how big of a problem toothache and tooth problems can
Yeah.
be for people.
Yeah.
But especially now when we're talking about dental shortages and appointments getting hard to come by, and I have a feeling they're just going to go up and up and up, which is the opposite of what we want.
Yes, definitely. And as you say, with access to dentistry being at the forefront of most of the news, prevention really is the best way we can help people to keep their mouths healthy. But, there will be times, and, the majority of people at some point in their life will have toothache. I mean, I think we've all kind of felt a little niggle or had a little jump when we have something that's a bit cold or and it's unpleasant, but to lose that many days of work and school and when you think those are people that are in so much pain, they probably haven't been able to eat or sleep or are able to go to work, so that is some severe pain there.
Yeah, absolutely. Because I mean, you have to be in a significant amount of pain with your teeth to have to take a day off work. I mean, we're talking beyond the point of paracetamol and other easing things that you can do. But I mean, is there anything more you can do besides just a paracetamol every few hours or
Yeah, I mean, obviously there are other painkillers. So if you do find that the regular one that you take for a headache or other kind of pain is not touching it, I would go down to the pharmacy and see if there's something stronger that you can get over the counter. You may be able to take like an ibuprofen kind of medication. I know not all people can take that. It is an anti-inflammatory, so it does work quite well for dental pain, but it is quite rough on the stomach, so you do need to have it with food, so you do need to be able to have had something to eat to take it. But there are different types of antibiotics if you can't take that one, and your pharmacist will be able to get you something. If you've got swelling and things like that, that is looking a bit more, you need more professional help if it's something like that. But for the toothache pain, to tide you over, go to the pharmacist and ask about different painkillers.
what kind of things can cause a toothache then, do you
Well,
think?
there's lots of different things. I mean, ranging from a little bit of gum recession causing sensitivity, um, right their way up to an abscess or an infection, uh, which could probably be one of the worst pains I've heard it described as. And also, trauma. You could have had a
Yeah.
trauma to your mouth. So there's lots of things, and some may even be short term. I think sometimes if you've had a new filling placed, some people experience this, especially if it's quite a large filling. It takes a little while for the tooth to settle down after it. It's traumatized by having the filling replaced. So sometimes it can be a little bit painful afterwards, sometimes up to several weeks, maybe a month. But any longer, or if it starts to get any worse, then I'd go back to your dentist. Also, if you've had a new filling and you think you're hitting that filling first before the rest of your teeth, go back to your dentist, because they might need to just sort of alter the bite a little bit, and then the pain should go away.
Or alter the bite with the filling? What? How do you mean?
Well, the filling might be too high. So there might be too much
Right,
filling in the
right.
tooth. So what's happening is, as your teeth are coming together, you're hitting on that filling before the rest of the tooth. So it's taking quite a bashing there. So every time you're biting together, you're hitting that one spot. So it does tend to make the tooth a little bit jumpy. But again, a quick sort of alter of the shape of the filling that the dentist can do very quickly and painlessly, it will settle down. And the majority of fillings do settle down after a time. You might find they're a little bit touchy, as I say, to chew on for the first few weeks.
Uh-huh. And there's also things that could also be, let me rephrase that. There's conditions you can have outside the mouth that can affect your teeth as well. Like I know if I've had a sinus infection, that makes me feel awful. And it's like everything is interconnected, and
Yeah,
it
yeah,
can that can give you the feeling of toothache, but actually there's nothing wrong with your teeth at
absolutely.
all.
Absolutely. And, there are a lot of people that go, visit their dentist and say, I've got raging toothache. There must be something wrong with my teeth. And what it is um, a sinus infection or sinusitis. Because for some people, not everybody, but for some people, the roots of their teeth are very long, or their sinuses sit quite low in their face. So if you imagine where your nose is, sort of to the side of it where your cheekbones are, all along there is your sinus cavity. So if that becomes inflamed, it pushes on the roots of the teeth. So when you bite together, it's painful because you're pushing into something that's inflamed. So if you go to your dentist, let them check it. If they can't see anything dental, you probably need to go to the doctor and see if you need some antibiotics if you've got an infection there. And as soon as that inflammation has gone down and your head cold has subsided, your teeth will stop hurting as well.
Brilliant. Um, I think we've covered all the basics about toothache. Obviously, there's different things that you can go further into.
Yeah, I mean, as I say, that with something like sensitivity can be extremely painful, and if for some people it would just be a sharp jump when they have something hot or cold. For some people, it can last quite a long time. It can be quite debilitating. So if you do have it, on days like this when it's very, very cold, have a scarf over your mouth so that when you breathe in, you're not breathing in very, very cold air. Also, if you're using a water pick or anything like that, warm the water up. Don't have
God, yeah.
lukewarm water
Oh
as you go
my
through the
God. You
ceiling.
only have to make that mistake once, don't you?
Yeah,
Because
you
that's
only do it once.
horrendous.
Yeah, it is. And you can find, even if you don't suffer with sensitivity regularly, you can find a sensitive spot if you do it with the freezing cold water.
Yeah,
But a desensitizing toothpaste is always really good. Works for the majority of people. You need to use it for a couple of weeks. If it works for you, don't stop using it, because the minute you stop, the
it'll come
sensitivity
back.
will come
Yeah,
back. If you've got some areas of gum recession, when you've brushed your teeth at night and you're going to bed, just rub a little bit on that area, because your mouth's quite inactive during the night. It tends to sort of have quite a good uptake. But if it persists or it gets worse, again, go and see your dentist. The other thing I would say is, when we're going right to the other end of the scale, is, like I said before, if you've got excessive swelling, or swelling that is potentially going to interfere with your breathing. So if it's on the lower jaw and you're getting quite a lump, you need to go and see a professional. If you can't get in with your dentist, phone 111. and
Hmm.
explain to them you've got swelling. So swelling, excessive bleeding, and extreme pain, it's 111, and they will get you an emergency appointment because you need to be seeing somebody. You
Hmm.
need to get rid of that infection, whether that's sort of antibiotics, or whether they need to sort of excise the abscess, or even open up the biting surface of the tooth so that anything can drain away. And as soon as that happens, it's almost instant relief because the pressure has gone away. So, anything like that, please get professional advice,
Yeah.
um, because we don't want you to be in a worse situation.
No, absolutely not. Now, I think we've covered everything we can in the time we've got today. But you'll never guess what day it is next week, Karen.
Let me think. Okay, let's have a nice one, shall we? Um, it's going to be a National Dental Nurse Pat on the Back Day.
That's every day.
Oh, okay,
Every day in
okay.
our office, anyway.
Absolutely, yeah,
It's
yeah.
Valentine's Day.
Oh gosh, is it?
Yes, it is. So we're going to be back
Oh,
talking about how to keep your breath smelling brilliant, and also some oral health friendly Valentine's foods, cheeses, and things like that. So just a little bit of fun, a Valentine's gift from us to you. And thank you for listening. Come back for that next week.